Well, welcome back. Today we're in psychological health and we're talking about recommendation number 4, foster optimism. Optimism is defined as believing that good things will happen in the future. And the mental state of being optimistic has been shown in a large systematic review to reduce risk of premature death. The higher a person's optimism, the lower their risk of premature death in the follow-up. The lower their level of optimism, the higher their risk of premature death in the follow-up. How exactly does having an optimistic attitude affect health? Well, it's purported to do so in two ways. One is indirectly through behaviors, and the other is directly through physiological processes. So it's been shown that people who are optimistic about the future tend to engage in behaviors that support long-term health. We said the same thing for people who have strong life purpose. This includes eating a healthy diet, engaging in regular physical activity, and not using tobacco. Independent of the behaviors of people with optimism, there have been shown in studies actual physiological changes independent of behaviors. These physiological changes are all health promoting in people with optimism. They are reduced inflammation, longer telomeres, which directly relates with longevity. The telomere length predicts lifespan, and longer telomeres predict a longer lifespan. Improved cellular repair, lower stress hormones such as cortisol, and the impact of that lower cortisol is reduced blood pressure and decreased risk of diabetes and high glucose. So how exactly can you improve your level of optimism? It seems like something you're born with. In fact, it's been shown in the literature that optimism can be improved, that it's a mental state that's modifiable. There's two ways to go about this. You could do it the self-help route or with the assistance of therapists. In the self-help route, there's the best possible self-exercise. What you do is write down how you imagine your best possible self in the future. Think about 3 areas to write about. One is your personal life. How would if everything turned out the best way you could possibly, in the best case scenario possible, what would be your personal life? What would that look like? If relationships in your life turned out in their best case scenario, what would that look like? If your job or your profession worked out in the best possible case, how would that look? That's like just one paragraph. And if you do that exercise and take just 5 minutes for 14 days, 2 weeks, it's been proven in large clinical trials that your level of optimism not only changes and improves, but also stays at a higher state after the intervention. And the other option is therapy. A lot of times people who are pessimistic about the future have cognitive biases, like they think in catastrophic terms, like nothing will work out for me. And part of what therapy can do is to uncover those underlying assumptions and actually test them. Is it true that nothing works out for me? What if I try once again and see what happens? So you can challenge your assumptions in the hands of a skilled therapist. To find a therapist, and I recommend cognitive behavioral therapy when you're looking for one, you can look on your health insurance's website to see which providers are in network. I also provide a link in the resources section of this lecture, which is continuously updated with reviews by patients in my practice for therapists they're seeing. Many of these therapists are seen online, so even though There might be San Francisco based. It's likely you'll be able to have the option of doing telehealth visits with him. What we've discussed in this recommendation is optimism, or the belief that things will go well in the future, directly improves lifespan. It does so both by improving health behaviors that support longevity and health, as well as by physiological processes like cell repair and decrease in stress hormones. We talked about ways to improving optimism, that it is a modifiable trait, that you can do it on your own with a 5-minute exercise for 2 weeks, or seek the support of a trained therapist, ideally in cognitive behavioral therapy. Thank you very much for listening to this lecture, and I wish you the best of luck in improving your outlook on life.